Suddenly and inexplicably, she became unable to do simple math or say certain words. Doctors believed she was suffering from a mental illness and treated her with a cocktail of antidepressants and mood stabilizers. She suffered a grand mal seizure that lasted 1 hour, and 6 months later was misdiagnosed with multiple sclerosis. Her family urged doctors to test for a rare autoimmune disease that came back positive. With the right treatment, she showed tremendous improvements within months. Delegates, please give a huge hero's welcome to Emily Gavigan.
Good luck, you got this.
Wow. You guys are awesome. Thank you. I'm Emily Gavigan, and in 2010, I was diagnosed with anti-NMDA receptor encephalitis after over a year of misdiagnoses, ranging from psychosis unknown to multiple sclerosis. And I want to bring my story to all of you to spread awareness because I was saved because someone else shared her story. So let's just take it right to the beginning. I was a sophomore in college at the University of Scranton, and I was having a great semester, a great fall semester. I had just co-founded my school's first figure skating club. I was getting good grades. I dealt with some mild depression and anxiety, but I had a really great group of friends. That's me, back then. And I went home for winter break. One night, I was leaving a coffee shop I had been with some friends, and I got into my little Honda Civic, and it was almost like a flip switched in my head. I became totally convinced that the men in the car next to me were going to follow me home. And so I buckled up, and I drove home. I'm glancing in my rearview mirror, looking for their headlights. As long as there were headlights behind me, these guys were following me. And when I got home, I'm babbling about being followed. I'm completely paranoid, and my mom recognizes something's wrong here. So she calls my psychiatrist, who just advises her to give me some of my anti-anxiety meds. And I calm down, I go to sleep. The next day, we're headed to New York City for a trip. And everything seems okay, but inside, I'm still freaking out. And we're only on the road for a few minutes, but I'm convinced that the tractor trailers are talking about me on their radios. And I become so afraid that even though I want to go on this trip, I tell my parents, and we have to turn around and go home. So we end up at my psychiatrist's office, and she had recently moved into a new space. So it was these crisp white walls, drop ceilings, no decorations yet, and I refused to speak to her. This wasn't a doctor's office, it was a set. There's a microphone in that plant over there. They bugged the ceiling, and they're listening to everything I say. So since I'm clearly not speaking to my psychiatrist and I'm exhibiting all these signs of mania and paranoia, she sends us to the ER. And there I don't trust anyone either, but I recognize deep inside that there's something wrong with me. Why am I thinking this way? Why am I acting this way? So I listen to the doctors and the nurses and my parents, and I check myself into a local psychiatric facility. At this time, I'm 19. I'm a sophomore in college, and I'm technically barely an adult. So I'm there for 2 weeks while they switch up my meds, all these really heavy mood stabilizers and antipsychotics, and they send me home after 2 weeks to go back to school for the semester. I've only missed a couple days. But school doesn't work out, and I'm sent home into another psychiatric facility, this time for 3 weeks. While I'm there, same thing. They're just switching up my meds, trying to find a diagnosis, and I'm laying in bed doing Sudoku puzzles. So they've thrown out schizophrenia, it's not that. Bipolar disorder, it's not that either. And they settle on psychosis unknown. I'm released from the hospital again, this time on 4 really heavy mood stabilizers. I can't go back to college, so I have to do a day program at a local hospital. And while I'm there, in group, we're talking about our problems. My only problem is I'm not here. I'm here. I'm not in school. I'm not with my friends. And eventually, they decrease my meds, and in the fall, I'm able to go back to school. And the semester goes okay. Everything's going okay. I'm seeing a psychiatrist. Well, this is me when I go back to school. So I'm seeing a psychiatrist outpatient, and I tell him I don't like the way the meds make me feel. You can tell I'm puffy. I've gained a lot of weight in just a short amount of time. I was weighed down heavily in my mind by all these drugs, completely zombified. And he says, if you stop taking them, if you're non-compliant, I'll drop you as a patient. So to my parents, that was like the worst thing that could happen. This guy was our last resort. That was it. At the same time, I began experiencing some numbness in my face and my hands, so I saw a neurologist. And this neurologist got an MRI done. It came back irregular, but he claimed that the radiologist overshot the photo, and all I was experiencing were side effects from my medication. In January of that year, a woman appeared on the Today Show. She had written an article in the New York Post called My Mysterious Lost Month of Madness. She had anti-NMDA receptor encephalitis. Susanna was experiencing paranoia about bed bugs and seizures, and eventually she was treated for this disease and recovered fully. My aunt happened to catch this 3-minute segment on the Today Show, and it stuck with her. So she emailed it to my dad, and with just a brief message, this sounds like Emily. So my parents showed this article to my psychiatrist, who completely dismissed them, told them this couldn't possibly be me, that they were in denial, that their daughter would never have a normal life. And they left completely dejected, and life just kind of continued on. It wasn't until spring break of 2010, when I packed up my car, fine, returned home, that my physical symptoms began. The next day, I was sitting at the kitchen counter eating a pint of Ben & Jerry's, probably fish food, and my mom noticed that I was laughing inappropriately, and I was holding the spoon like in a fist, like a baby might, and soon I'm unable to speak at all. So my dad calls my psychiatrist again. He refuses to speak to my dad because I'm an adult and I need to take responsibility for my life. And when I'm unable to respond to his questions because I can't speak, my doctor hangs up on me. So the next day, we're in my therapist's office, and the right side of my face starts to droop. We immediately get in touch with my family doctor and get to an ER. He suspects that I have multiple sclerosis, and the neurologist that I've seen the year before comes in to confirm. So this is me just a few months later. They send me home with steroid IVs and say, you'll be great to go back to school when spring break's over. But I continue to worsen. I can't use my right hand. I'm not eating. I'm not speaking at all. And soon I'm completely unable to walk. So we go to another local ER because this isn't working. And the doctor there takes my MRI from years before and the MRI that I just recently had, and he has them up on the screen. And he shows them to my dad, and he says, Mr. Gavigan, I don't know what this is, but whatever it is, it's been going on since last year. So they decide that what's going on with me is autoimmune, and they start treatment with IVIG. The IVIG causes me to develop a blood clot in my brain right on the top of my head. And this causes a grand mal seizure that lasts for over an hour in my tiny ICU room. So at this point, I'm nearly dying. And my dad remembers this article from 3 months ago and urges my doctor to read it. he agrees to get me tested if I'm not better by the end of the weekend. Anti-NMDA receptor encephalitis was discovered at the University of Pennsylvania by Dr. Joseph Daumow. And on Monday of that week, I was life-flighted there in critical condition. Once I arrived at the hospital, doctors suspected that this is what I had, but they couldn't test me, and I continued to get worse. I had a grand mal seizure that lasted for over an hour, again, and left me unable to breathe on my own. So I was on a ventilator for about 5 days, but spoiler alert, I was weaned off the ventilator shortly 5 days later. Thanks. I still hadn't improved that much in the grand scheme of things, so one day a resident decided to take matters into his own hands. He wheeled my hospital bed out of the room and down for a spinal tap. I was at this hospital for 5 weeks before we finally got our diagnosis of anti-NMDA receptor encephalitis. And from there, we began treatment with rituximab, an immunosuppressant similar to chemotherapy. I had this treatment and then intensive occupational, physical, and speech therapy. Even after the first round of rituximab, though, they noticed improvement, but I had a long way to go. When my dad first handed me a toothbrush, I didn't know what to do with it. So I continue to work hard in all of my rehab. I'm out of the hospital. I took another semester off of school because I wasn't quite ready to get back to myself, but between working really hard and all of the support of my family, I made it. And when I got my diagnosis, my dad reached out to Susanna. She was in the beginning stages of writing her book, Brain on Fire. When the book launched in 2012, we appeared on the Today Show. It was a great press for the book, it was a good story for the Today Show, and it created a lot of awareness for autoimmune encephalitis. And I know this because the day that our segment aired, a little girl in Nebraska, a 6-year-old, was diagnosed because we shared our story again. And Brain on Fire premiered last week on Netflix as a movie, so I hope you'll all watch it. So why then would I still need to bring awareness to this disease? It's got a movie, it's got a New York Times best-selling book, all generating this awareness. Well, I was really lucky to be treated at the hospital where the disease was discovered. I was really lucky to have supportive parents who could advocate for me when I wasn't. I have an incredible support group of family and friends who were there for me. And a lot of it was the right place at the right time. Not everyone has those privileges. There's also a really wide range of symptoms and patients. So anti-NMDA receptor encephalitis typically affects young women in their teens to mid-20s, but I know a 70-year-old man who was diagnosed, and I know a 2-year-old who was diagnosed. And often it presents with psychiatric symptoms, as it did in my case, but not with everyone. Sometimes it's headaches or seizures. Also in women, a lot of the time, it's caused by an ovarian teratoma, the monstrous kind of tumor that has hair and T cells inside, and the antibodies are in reaction to that. I didn't have a teratoma. I will probably never know what triggered the immune response in me. So, given this wide range of patients and symptoms, it's not a huge shock that there's a lot of contention surrounding a disease that was really only discovered within the past decade or so. There are rituximab, which saved my life. That drug, if I didn't receive it, I would absolutely be dead. It's considered a second line of treatment in autoimmune encephalitis. after steroids, which I received, IVIG, which I received, that didn't help me. And insurance companies don't always want to pay for those second line of treatment. Not every doctor is aware of this disease. I have friends who received a verifiable diagnosis, and they can't find a doctor locally to treat them. Now they have complications from this illness. There are organizations like the Autoimmune Encephalitis Alliance connecting patients with physicians and helping them to navigate this disease. But it's not always enough. So I feel really honored to be speaking to all of you who may be doctors in the future, maybe navigating patients in the future, seeing them. Because when I was diagnosed, there were only around 400 patients in the world who were diagnosed with this disease. And as awareness has increased, the number of patients has exponentially increased. Thank you. There is real, tangible value in sharing our stories. And as the doctor who listened to my dad and got me tested also proves, there's real value in listening too. So, thank you.